On this special episode of the ASC Podcast with John Goehle, we visit the Ohio State Association annual meeting on September 27th and 28th in Columbus, Ohio, and meet with leaders to discuss current issues in the ASC industry in Ohio.
Welcome to the ASC Podcast with John Goehle, the longest-running podcast specifically focused on the freestanding ambulatory surgery industry. This episode is sponsored by Surgical Information Systems, providing cutting-edge information solutions for surgery providers and ambulatory healthcare strategies, the nation's leading regulatory compliance resource for ambulatory surgery centers. For more information about our sponsors, please visit our website at ascpodcast.com.
Welcome to episode 143 of the ASC Podcast with John Goehle for November 4th, 2021, recording from Hilton Head Island and from the Ohio Association of Ambulatory Surgery Centers annual conference held at the Hilton Polaris in Columbus, Ohio on September 27th and 28th, 2021. This is Susan Cronkite, Chief Researcher for the ASC Podcast with John Goehle and Senior Nurse Consultant for Ambulatory Healthcare Strategies. Joining me is John Goehle, the owner of Ambulatory Healthcare Strategies, and recognized as one of the nation's leading experts in the ambulatory surgery industry. Mr. Goehle is the author of over 10 books on the ASC industry and a frequent industry speaker on regulatory accreditation and finance issues.
So we're recording from our temporary studio here in Hilton Head Island as we're attempting to vacation together. That hasn't worked out very well, hasn't it?
No, it's been kind of a busy week. But we fit in a little bike riding and walks on the beach, so can't really complain too much.
No. So, and then we also had this problem. We brought the studio with us, but I left all the cables at home. So we're recording on my Mac, so you're going to have to apologize for the quality of the sound. Our goal was to actually get 3 episodes out. I think we're going to get 2 out. Unfortunately, it's just we are so far behind in everything here. And of course, this conference was over a month ago, but it was a great conference. We did have our full studio when we were in Ohio. Mm-hmm. And we're able to interview all the leaders there. We didn't have an opportunity to really interview any of the vendors. We had a couple people that we were able to interview, which we'll include here, unlike what we're normally able to do. I think people are still getting used to getting back to normal, and it was a pretty hectic schedule. But the conference was great. There was great attendance, as there always is in Ohio. The great sessions, those that we were able to see. I did another session on 30 years in the trenches, similar session to what I did at the New Jersey Association conference earlier in the third quarter. We did get to meet a lot of vendors too in person, which was the first time. I had an opportunity to have dinner with our sponsor, SIS. You bailed on us that night.
I did. It was a long day. I don't know.
She was exhausted, but I got a nice meal and an opportunity to meet with all of our friends over there. You know, the Ohio Association Conference is really one of the best conferences in the country. I really put like Ohio, California, New York conferences, which we visit frequently, all on a certain level because of the quality of the educational programs that they offer and the consistency of being able to bring in top speakers. And Ohio did not disappoint at all. And I wish we had an opportunity to get out to California. We did talk to Beth LeBoyer about California. We just weren't able to make it this year. But Ohio was a great conference. And one of the things that they're really well known for is the first day of the conference, at least in all the times that I've been going there, is an infection control training. So they do a full day of training for infection control, which really helps. It provides really all the training that an infection control coordinator in Ohio needs to meet that requirement of keeping up with, the current infection control standards, et cetera. So if you are in Ohio, we really encourage you to become a member of the Ohio State Association to be able to avail yourself of these wonderful conferences and the ability to get for one fee, not only, the education you need in general for ASCs in Ohio, but also that critical infection control education. And as a result of that, we do see quite a mix of people at these conferences. So what a great conference it was. So what we're going to do is we have a series of interviews that we did, 2 interviews with speakers and vendors, and then we had an opportunity to meet with the former president of the state association, as well as the equivalent of an executive director right now. They are kind of in between times with the executive director, who will talk a lot about what's going on in the state. So let's take a short break, and we'll come back and we'll have those interviews. Thank you for being a loyal listener of the ASC Podcast with John Goehle. But did you know that you can enhance your experience and support the free podcast by becoming a Patron member? Patron members have access to ASC Central and add-on service at a very reasonable price. Patron members have access to our regular drop-in virtual meetings where you can discuss issues that you are dealing with in your ambulatory surgery center with the hosts and other members. Members also have access to valuable member resources, including a document library with a growing list of resources, including the rules and regulations, guides to maintaining compliance, example policies and procedures, infection control resources, example risk assessments, example committee and governing body minutes, and over 60 disaster drill scenario kits and example forms and checklists. Members also have access to some of the virtual conferences that we have presented, including the Provider Credentialing Conference, which we offered in December 2020. It's a New World Conference in 2020. Infection Control in-Service to meet the challenges of COVID-19, and the ASC Mandatory Education Program, which is a valuable resource for annual education for your staff. Membership helps to defray the costs of producing the podcast, including the research staff, travel costs to conferences, equipment costs, and production costs. For more information, you may visit ascpodcast.com. To become a member, visit ascpodcast.com. So our first interview was with Heidi Moss, and Heidi leads the member services team for the management company that manages the Ohio State Association. She talked a little bit about preparing for the conference, what was going on during the pandemic, and how the state association really helped members to a high degree, as so many of the state associations did. So if we look at what was happening during the pandemic, the ones that we work with the most, like New Jersey, New York, Ohio, California, those state associations really stepped up and helped out. And Heidi did a great job here in this interview of explaining what they did during the pandemic, how they pivoted to be able to do virtual conferences, and then what they did is they started to plan this in-person conference. So let's listen to that interview. So Sue and I are here with Heidi Moss. Heidi leads up the member services team for the Ohio Association of Ambulatory Surgery Centers. Welcome, Heidi. Thanks so much for joining us here.
Hey, John. Thank you for inviting me in to say a few words. I'm really looking forward to it.
And congratulations on getting back to live conferences. I know that this has been something you've been wanting to do for a long time, and boy, we've all missed it. Now, this is my second live conference. I was in Texas last week for it, so a little nerve-wracking still, because the crowd is different. Of course, we're all wearing masks here, which is very different. I can't understand Sue when she wears a mask anyway. And that's why we're having the challenge. But but it's great to be back in person, getting to see old friends again. And it's been hard to believe that it's been 2 years.
It really is unbelievable. And we were so happy to be able to make this happen because it was a great unknown to us, maybe until even as recent as 3 months ago. Right. Is this going to be able to happen? Yeah. And we really wanted to do it for our members, not only just for their kind of like the well-being of them and getting to see each other, but they need this education. Yeah. And we needed to do it for our vendors and supporters as well and bring everyone together. So we're so happy that this has worked out.
So I'll just state a couple things. First of all, Ohio's association is probably one of the most active and one of the provides a lot of educational services. It has something not totally unique. Several state associations do this, but you do your first day of each annual conference is totally on infection control and is meant to be designed to meet the requirements of CMS in the state to assure that your infection control coordinator is up to date. So we're actually recording on the first day, and that's what's going on in the background here as we're recording. So that's a great thing that you offer to your members. And you don't have to be a member in order to attend for that reason, but it's certainly a very important part of the educational program.
It is, you're right. And we actually did a lot of thinking. Because of all of the unknowns coming into this conference, we did change our format a bit.
Right.
We condensed things down, but we peeled off a day and we peeled off one of our 3 sets of breakouts. But we did feel that infection prevention is something so specialized that we do, and we do dedicate that full day that it was too important to the members not to leave on the schedule. So yes, we are focusing on that all day today. It's been a great program. We're super thrilled with the attendance that we have, and it seems to be going really well.
It is. I've been watching around, talking to a lot of people are coming up. We have our own booth here. Thank you so much, by the way. And speaking to all of the vendor listeners to our podcast, I got to tell you, Ohio, I mean, we attend and we're members of a lot of associations. Ohio treats the vendors very well. You've done a great job with us during the pandemic. And thank you for the hard work that you've put into this.
Oh, you're absolutely welcome, John. And we've been, it's been really a two-way street because there's been, for those of you who don't know, this conference was postponed twice.
Yeah.
And our vendors have been great supporters, and they have hung with us through the bad times and waited and had been patient, and they've rolled over their fees and really worked with us. Yeah. And it's been a wonderful partnership between those vendors and the association.
And I've been walking around talking to all the vendors. Of course, I keep seeing the same vendors, of course, at all the conferences we go to, and very happy. And plus this attendance has been great compared to some of the other conferences that are going on. So obviously you've gotten the message out there. And so I'm going to be a little sad for a second because Randy Lefler joined us many times over the years on the podcast. He unfortunately passed away very suddenly in 2019, around Christmas time in 2019.
December 23rd.
It was the 23rd. Oh, my goodness. And we had just seen him not very long before it, and it was quite a shock. And I know that you are, as an organization, you're still reeling from that. It was 2 years ago, and God bless you for having to step in, Heidi. And I know we were just joking earlier that you're heading up the member services team. Nobody has really appointed officially an executive director yet.
And I think COVID has played a huge role in that because we lost Randy. And a little background: I was a teammate of Randy's, so I was still involved in the operations of AASC along with some other teammates, but just not, that on the front lines with him. And it was such a shock, even to us as an organization, to lose him as a team, and then to the client to lose him, and then to try and serve the client and to comfort them and help them feel comforted, but also confident that things will keep moving, and then also work through our own, sadness and challenges. And then COVID came a couple months later and threw a whole new set of challenges at us. So
well, let's talk about, everybody reacted differently during the pandemic. You really didn't get into the virtual conferences like a lot of organizations did. Actually, I think a lot of it is because you really expected to be able to do a live conference. You did have to cancel it a couple times. So you kind of went down one road and unfortunately weren't able to do it live. So talk a little bit about, how the Ohio Association reacted, how it helped its members absent those regular meetings that you had.
Yeah, absolutely. Like you mentioned, we are a fall meeting, so we had high hopes. In Ohio here, it was 15 days to flatten the curve if everybody hunkers down. And so we had a great amount of hope that we would still be able to make it happen in October. And then it became clear that we wouldn't. So we didn't delve a lot into virtual that early because we were wanting to believe we would still be able to bring everyone together. So what we ended up doing, as you mentioned before, the importance of the infection prevention, we did hold for our members and non-members a 6-week series on infection prevention so that they all could still get their hours, get their experience. And it was really well attended.
Good.
The members were incredibly appreciative, and we were so relieved that we could offer them something. And then, otherwise we just tried to work as closely as possible with the Ohio Department of Health. So we always had the most up-to-date information that was going to affect our members and the centers in Ohio, and just to try and keep them informed and make them feel at ease, if that was even possible, but at least let them feel like they knew what was happening.
Right. And it was very important. I think the state associations, many of them came on their own, really the pandemic. So many, Sue and I were joking, other places, many of our competitors actually kind of shut down during the pandemic, much as many of the centers did. But we were busier. I mean, we had this morning routine. We'd get up at 7 o'clock in the morning. We would parse through the news. We had, 11 o'clock New York State governor was on, and then New Jersey was on, all the places. And we, like every day something was happening. At one point during the pandemic, we were doing daily live podcasts, for like 3 days a week. It was crazy.
But there was a need.
Yeah, absolutely. And as a state association, that's where you had to step in and help keep your members involved.
Right.
Talk a little bit about, what you did, just so people understand, hopefully we'll never have this, but we know something's going to happen again. Talk a little bit about how you stepped up during that time, not just with the conferences, which we've talked about, with other services that you provided to the members at that point.
Sure. I mean, I think what was most important to us and the board is being plugged in, making sure we understood the latest mandates or what was being prohibited by the governor's office. We were actually lucky enough to get on some conference calls with a team from the Ohio Department of Health. And that was actually right when, because as most states, we did have our elective surgery procedures, there was a stop put to them,
Right.
a shutdown. And, we were able, with the help of some, government affairs folks, to get on the phone with a team from the Ohio Department of Health and get very detailed information about how our folks should be navigating this time. And that was, I think, what we focused on in the very beginning, is just making sure that everybody was represented and informed, and getting news out to the members. We, I'm sure a lot of groups did this, but we had our COVID-19 resource section. So there was a lot of news going out, a lot of resources being posted, a lot of alerts,
Right.
Everything we could do. And then, and later down the road, it became, what can we do to help our centers stay active? Well, you have an opportunity to be a vaccine provider.
Right,
so it was helping inform them about that potential opportunity, giving them the tools they need should they choose to want to do that, so they could keep things going. Just like I said, a lot of it just making sure they had the information they needed to be able to do the best that they could in such a difficult time.
Yeah.
So a lot of news pushing out, a lot of meeting with the board, a lot of interaction with the Department of Health.
So you weren't sitting at home doing nothing during that.
No, absolutely not. When you mentioned that you were having 7 a.m. meetings,
Yeah.
I thought I remember those 7 a.m. to 10 p.m. days
Yeah.
really, really well. There was a long string of those, just
Yeah.
constant communication between the board and myself, the rest of my team, the different folks with the state that had information that we needed or could answer our questions. It was a very busy time, lest people think that because centers couldn't do procedures, there was nothing happening. I assure you, there was a lot happening.
So talk a little bit. So again, Ohio is probably one of the most active state associations in many ways. You really have a lot of interesting programs. The one that comes to mind right away, because we have a couple centers in Ohio that are part of Ambulatory Healthcare Strategies. And of course, your benchmarking is an incredible tool for us. We love using your benchmarking in our quality improvement program. So that's a big benefit. I believe that's free for members, correct? Or is there a charge?
No, John, you are correct. It is free for all of our members to use, and it is one of the member benefits we're probably the most proud of. As a matter of fact, we have like a reporting session that opens this coming October 1st.
Okay.
So I'll
the third quarter.
Yeah, I'll be resetting those surveys on Thursday, so
Yeah.
folks can dig in and start entering their data on Friday. And it's all the members, I think a good portion of the members are very, very involved in using that tool. It's very important to them.
It's an important tool for our centers in Ohio, and the fact that it's free, is very good. I mean, a very, a big benefit. Talk about the other benefits, though. Why should people join the Ohio Association of ASCs?
I think that the association is the best way to really understand the things that are affecting your center that might be beyond what you're seeing day to day. There are all these outside factors happening amongst the state and federally. We work closely with the National Association. And so sometimes I think it's very easy for people to kind of get tied up in their silo of this is what my center needs. And you need someone to remind you that there are things going on a bigger stage that you still need to know about and hopefully be involved with, whether it's letter writing campaigns to your Congress people or even your local General Assembly. We try to keep everybody aware of that, and we really encourage them to get involved and to try and reach out to their government officials. It's things like that, helping them understand the tricky thing about associations is you get out of it what you put into it. Right. So we are trying to give them an easy way to be engaged so that they can do the best things for their center that they absolutely possibly can. Well said.
Membership, to get information, you go to the website, and we'll put a link in there.
Yeah, absolutely. I mean, we're at www.oaasc.net.
.net, right.
Because .org is the benchmarking system. So it's .net, but there's a join option right on that top menu. And, we have a formula where there's a base rate, and then it's actually a formula by procedures
Number of
per
procedures
year.
Yeah.
And, starting in the fourth quarter, we're happy to work with people. If you join in the fourth quarter, we can extend that membership through the end of next year.
That's nice.
So that you're kind of getting in and you don't have to turn around and pay dues again. So if there are folks out there that are interested, definitely reach out because we can do something like that.
Tell us a little bit about the conference and putting it together. Now, it's been interesting. I was in Texas where we weren't wearing masks down there, but here everybody has to wear a mask. By the way, I didn't even ask, did the speakers have to wear a mask?
No, because there are this interesting list of exceptions, and there are a lot of exceptions. And one of them is that sort of formal speaking engagement situation.
And I do appreciate the fact that we don't have to wear the mask while we're eating. That was very nice.
Yeah, that's helpful, isn't it? Yes. You can take your mask off. Someone earlier today told me that she asked if she could claim a lipstick exemption, that she had just applied fresh lipstick, and she was hoping that she could be excused from wearing her mask right away.
And by the way, thank you very much for putting me on after Kara Newberry tomorrow. Hometown girl here, of course. Kara is with the ASC Association. She comes before me.
The thing is, John, a lot of people don't get super excited. It's necessary information, but it's not necessarily what gets your blood pumping unless it's bad, and then it gets your blood. So I think you will be a welcome.
There we go.
So, but it's great to have Kara right here.
Yeah, it is. She's such a great team player. We missed her in New York because so New York is going to have Bill. And so because you stole Kara here, so we understood that completely. Well, thank you so much for joining us here. This is a great conference, and I appreciate all the hard work that you've put into putting it together.
Thanks so much, John. I'm so glad that you and your team could come out, and I just hope you have a great experience here in Columbus.
Thank you so much.
And our second interview was with Tori Kalet, who is a very good friend of ours. Tori was the administrator for one of our clients, the Worcester Ambulatory Surgery Center, and she is the immediate past president of the Ohio State Association. We interviewed her, and she talked about the state association, current issues that are going on in the state. We did try to interview the president. Unfortunately, she had to rush off before we were able to do that interview. But Tori did a great job, as she always does, talking about the state association and its activities. So let's listen to that interview.
So this is John Goehle. I'm here with Sue Cronkite, and we're interviewing such a dear friend, Tori Kalet, who had been a client of ours for a long time, and then she moved on to work for one of the major management companies, and she's joining us on behalf of the Ohio State Association. She's the former president. Barb Drave snuck out on you. How did that happen? She snuck out, so now you have to represent the whole state association. Well, welcome, Tori, to our podcast.
Thank you for having me.
So a lot has happened since you and I last talked. And we interviewed, I think it was 2 years ago, almost about the same time of year.
Yeah.
And I think you were just the outgoing president at that point. You might have been still the president during the meeting.
Yes, I was.
That's correct.
Yeah.
So now, unfortunately, you have to represent the entire board today to kind of talk a little bit about what's going on. We interviewed Heidi earlier, and hopefully, when we put this podcast together, we'll remember to put Heidi first and then Tori later. But Heidi told us about the membership and, membership advantages and what the challenges of going through this conference. One of the things that's been very challenging for the association, unlike many of the other state associations, you really didn't go hog wild into virtual conferences like New York and New Jersey and California did. So it has been challenging, and this meeting has been very important. I do want to say on behalf of all the vendors as well as, just attendees here, we very much enjoyed this trip here. As always, Ohio does a great job.
Good. Yeah, we were very happy that our vendors chose to leave their deposits with us and come back and wait for us to have this, because one of the things at the board level was we didn't want to do virtual because we just all felt that the virtual wasn't going to be as well perceived as in person, and I think it has been well perceived this time. It's been a great conference, and if nothing else, everybody's enjoyed seeing each other and getting a chance to just sit down and talk with your fellow ASC person.
I think that's one thing that's different. Going to a lot of state association meetings, I just came from Texas, heading over to New York from here, is that I think the collegiality of Ohio seems to be very high. I think you guys work together very well. Everybody seems to be friends with everybody else, and not to say the other state associations don't have that similar thing, but it seems to be much bigger here. Maybe it's part of being in the Midwest. I don't know.
Maybe.
Yeah, we'll say that.
We've all been on the board a lot of years together, and our board works that you have to sit a year out after you've been on for so many years before you can run again.
Yeah.
But we've always managed that we are able to kind of stay on, even if it's an ex officio.
Yeah.
And after the passing of Randy, we really started to enforce that. Before, Randy he liked keeping the people around that he knew and everything, and we all worked so well together.
Yeah.
But next year, I will be on the board as an ex officio member because I finished my second year up as past chair. Yeah. So I'm basically taking a year off, and then next year I'll probably try to run for something on the board again.
Yeah.
Because I like to stay involved with the Ohio Association.
Well, it's been a great meeting, and we're going to talk. We're going to do a separate interview of you because you have a nicely titled session coming up. So, what is it? Doing this will make your center a top performer. So I'm going to really grill you about how you're going to do that. It will be fun. It'll be fun. So talk a little bit about Heidi talked about what you did. What the association did. Talk a little bit about being on the flip side, some of the experiences you had during the pandemic and what type of information and how you perceive, from the board perspective how you're going to handle things in the future. Have you learned a lot as a board from this experience?
Yeah, I think we did. We learned that how important our management executives are because they stayed on top of the mandates coming out, and the fact that we have that Fitzgibbons group that is in the State House themselves, and they were able to say, hey, there's going to be an executive mandate come out. And so, we were all able to listen. And then Select Association Management, or Heidi, our person, she would put the information together. She'd send it out to the board. And now I know what's coming out right away to help my ASCs in Ohio. And after the board looked at it, then Heidi would send it out to all the members. So you knew that the governor was going to mandate masks an hour before the actual thing came out because it was coming. Yeah. And, the Ohio Association was right on top of it and getting that information out. And I think that's very helpful as a member of the association to get that information ahead of time.
Yeah, it can be so confusing keeping up with all of those changes and everything. It's such a useful thing to have somebody that can kind of interpret and make you aware of those
every
things.
time you turn around, they're still changing. And, being part of a national company now, I still use the Ohio for my centers in Ohio, but it also kind of helps me. If Ohio's doing this, guess what? Some of the other states are going to follow suit here real soon. So it kind of gave me an idea, knowing that there'd be more coming up, and I could share with my peers what was happening in Ohio, and they would have an idea of what's coming for them.
Yeah. You're on top, obviously, of some of the legislative things. And I know that's not one of your main responsibilities. Barb Draves is supposed to be here, but she had an emergency, so she had to leave. So just give us an idea of some of the things that you have been dealing with from legislative. Actually, before you say that, or talk about that, talk a little bit about your relationship with the Ohio Department of Health, ODH, and then also talk about the relationship of the organization with the legislature, how you can interact with the government.
Yeah, we try working with ODH and finding out what the interpretive guidelines are going to say, because, I can interpret them one way, you can interpret them another, and then, ODH may completely interpret it another way. So we try working with them through Heidi or through another member of the association, because as an administrator, you're a little bit leery of calling the Department of Health yourself and saying, hey, I got a question for you, because you're kind of afraid that they're going to show up on your door next week. Honestly, I don't think that happens, because I have a lot of ASC administrators that do call the Department of Health and ask them questions, and they've just built a relationship with those people. And that's actually in my talk today, that you should have a relationship with with your Department of Health, because they will answer questions for you. And honestly, I have never really seen them be punitive. It could happen. I haven't been in the industry long enough to know if maybe they used to be, is why everybody's afraid of them, or just because we're afraid of them because we're administrators. And
well, you're right. I think for the most part, my experience over the years is much better to get to know them before you have an emergency or something that's going wrong. I think during the pandemic, those organizations that had contacts at the Department of Health felt much more comfortable calling them. Oh, I've got an exposure. What do I do about it? Et cetera. So I think that's a very good takeaway from that.
Yeah.
So during the pandemic, by the way, I should mention, because I don't think we introduced, you are with AmSurge now.
Yes. I'm a senior clinical director, so I clinically support 16 ASCs, not just in Ohio. I have some mostly New England type states, and Minnesota and Missouri.
Oh, wow. So, you have quite a territory.
So I have a pretty decent sized territory. My two newest centers are Massachusetts, so I'm just now learning some of the state regs and rules for Massachusetts. So that's a little bit new to me.
If she's going between Massachusetts and New York, and if she has to drive, she at least has to go through our state. But who wants to drive that distance? That's for sure. So let's talk a little bit about the legislative issues that you've been running into here and some of your challenges lately. I know really everything going on is largely with the Department of Health, but I know there's some legislative issues.
Yeah, there's a new, I'm not sure if it's a House bill or Senate bill. You'll have to look that up. Yeah. But they are looking at redoing the rules for ASCs in Ohio. And so the Ohio Association is really on top of this, using lobbyists from the Fitzgibbons group. And, they spend a lot of time at the State House in Columbus, and they know everybody and sit in there and talk to everybody. And they really got the ear and was able to get them to at least listen, instead of rewriting all the rules for Ohio ASCs to fit, certain criteria for everybody to fit in. They're looking at some of the proposals. I think there's like top 5 that we really rejected the way they were written. And so they're working with us on having them written to the way that they will benefit ASCs all in general, not just, not just certain styles of ASCs, but all of them. But, why rewrite all the rules when they're there? They just might need some updating.
Right. And Tori's, of course, referring to the licensure regulations in the state for ambulatory surgery centers. And you're right. So many of these regulations were written, in the very beginning stages of ASCs. You'll learn in Massachusetts, for example, that those are very old regulations, since Massachusetts is one of the first states to get involved in it. And then go to Connecticut and you'll see something even stranger out there. I don't think any of those regs have changed since 1970. So. Okay. Yeah. Good luck with that. I think it's an interesting legislative situation right now. It's about time they start rewriting those regulations.
Yeah, some of them need some updating, and they just need to make it easier for us to comply to them, as opposed to having them be a little bit interpretive. Some of the things we didn't want changed, like, if you get an inspection, we didn't want the time frame changed. We are prepared to fix within our normal time frames that you guys give us. The Ohio Department of Health gives us to fix stuff. We're not asking for that. We don't need that.
Right.
So why change that?
Just for the sake of changing things. Yeah. And
the Ohio Association is also on top of surgical smoke. A lot of the states have already required that you, in the operating room, have a way to evacuate the surgical smoke. Well, Ohio...
It's AORN initiative that's been going on nationwide.
Right. So Ohio hasn't pushed it through yet, and I asked about it at our board meeting the other day, and right now it's kind of sitting where it was because of their breaks.
Yeah.
So it got brought up, and then they went on break and all this other stuff. So it'll be coming back up. So shortly, Ohio will be joining, I think, what is there, 13 that have already...
Yeah, I think you're right. Yeah.
That have already adopted it. So Ohio will be joining them soon.
What do you think are some of the biggest challenges in Ohio? And I know your territory is a little bit larger, but what do you think some of the biggest challenges for surgery centers in Ohio right now? Like in New York, for example, the vaccine mandate is a big deal. And in New York, we're also dealing, suddenly surgery centers have to deal with things that are outside of the ASC regulations, like Department of Labor. Do you have any similar situations in Ohio? What's going on? Tell us maybe even the staffing challenges.
Yep. That was my number one answer right there. And that's not just Ohio, that's everywhere. But Ohio for sure, staffing. And once the mandate comes down that everybody be vaccinated in healthcare, it might even hit ASCs more. Another challenge here in Ohio that I wasn't as aware of, but down here in the Columbus area for sure, one of the board members was saying that nurses are being paid $125 an hour to go to work. And ASC can't. Yeah. We can't do
like
that.
The traveling nurses.
They're not even traveling nurses.
Oh, really?
They're nurses that are being hired for the floor.
Yeah.
Now, I hate to assume because everybody knows what happens to you when you assume.
Right.
However, from the talk at the table, which is the networking, which is the awesome part about the association, is that nurses are still being paid their normal rate, but then they're getting a bonus pay for coming in right now. Yeah. So, because that's, the first question was, how are hospitals going to continue to pay somebody $125 an hour 4 years from now? Yeah. Well, they're not. They're going to pay you your normal $35 an hour or $34 an hour, but they're not going to give you that bonus check anymore. Yeah. So maybe nurses will come back to the ASCs at that point in time. But I really think staffing is going to be the biggest hurdle for ASCs in Ohio because everybody's getting busier and you need staff to continue to grow.
Yeah. Well, and the governor of New York, by the way, just announced that for all the nurses that are going to quit their jobs or lose their jobs because they're not getting vaccinated, she's going to go recruit people from other states. So good luck with that.
Oh, yeah. No, there's
Thank you very much, by the way.
There's going to be nurses in Ohio that refuse to get it, you know. I kind of look at it like I was basically mandated to get the flu shot for the last, 10, 15
That's
years.
Right. Mm-hmm. Yeah.
So to me, it's the same deal. Yeah. And, you ask my husband, he's not getting a vaccine, and he don't want a vaccine. You know, I know that everybody has their own opinions on that, and I really don't want to be the one to say you have to have the vaccine. Yeah. Our company mandated it for the corporate employees to help protect everybody that we go visit. I travel all over the place, so I already had the vaccine. I wasn't concerned about it, but I do travel, and I do feel like it is my responsibility to protect the people that I'm going to go see as well. So I think that's going to be an issue as well.
We've been very supportive of it in the podcast. And I think, I'll say one thing again, we truly do understand everybody's concerns. We just ran into an individual today who had a very valid, I won't say valid, they had a very well defined reason for it. And we have to respect that. And, then if we feel like maybe that's not a great reason, we try to convince them or try to explain it to them, but we have to be careful. I will say this much from my standpoint. I know with you too, especially now that we have new grandchildren, I feel much safer having the vaccine. I do.
Yeah, like you said, in healthcare, it's been something we've had to do for quite some time, between the flu shot or having to prove we have other vaccinations.
I didn't exactly like taking the flu shot every year either, since I always got sick after the flu shot. I'm one of those that, gets a minor flu for a short period of time afterwards, and it's just frustrating. But this is important.
Yeah, I actually volunteered to give COVID shots in Wayne County where I live. I worked with the health department for some Wednesdays after work, basically for a couple hours every Wednesday, and helped out giving out vaccines. And that was part of my excuse to get myself in there and get the vaccine right away too, because not being on the front lines, it was hard for me to say I deserve the vaccination. But I thought, if I volunteer some time, then I can get the vaccine. And I gave more shots than I ever gave my whole career as an OR nurse in those couple of months of just, a couple hours at a time.
It probably felt good, too.
It did.
Yeah, that's good.
It did.
Well, as always, Tori, it's great having you on the podcast. Thank you for representing the entire board.
I hope I did it justice, Barb. But
well, it's Barb's own fault, for this. But it was great seeing Barb. It's great seeing everybody here.
Absolutely.
And as always, thanks for joining us here.
Thank you.
And our next interview was with Scott Megason of MD Strategies, and he talked about emergency preparedness and how it can affect your billing and coding, how to be prepared.
Yeah, it was great because our booth was right next to Scott's, and we just got talking about various things, and Scott and I have been friends for a while, and I honestly, Sue, don't remember how we got into this conversation, but we were talking about emergency preparedness in general, and he said, you got to be prepared for the possibility of your computer system going down or not being able to code and bill, and what the ramifications of that would be. So
or somebody being sick and not being able to do it for a little while. So it was an interesting take on emergency preparedness.
Yeah, and we even talked about, perhaps doing a drill for this sort of thing. So let's listen to this interview with Scott.
So this is John Goehle. I'm here with Scott Megason. Scott, you and I have known each other a long time. So everybody probably knows you from emails that they probably get, right?
Probably. We've been sending out a newsletter on coding topics for 10, 12 years now. That's
right. And you are regular. We just saw each other down in Texas at the Texas Association. Are you going to New York? I asked this question
I'm
already.
not going to be able to do New York this year, but I'm hoping to add that into our schedule for next year.
In the spring in particular. That would be great. Well, thanks. We're here at the Ohio State Association meeting in Columbus, Ohio. It's been a fun day so far. Sue just joined me.
I'm here now. I just got back. Had to plug in my computer.
So, Scott, you and I have been talking. We've been talking for a while about what we would bring you on the podcast to talk about, and we were laughing because I think we talked in Texas about a topic, but neither of us can remember what it was that we were talking about. So, obviously, probably wasn't excited about what we just talked about.
Yeah, well, unfortunately, with coding, there's not a lot that is exciting. It's very necessary, but it's not typically exciting.
That's right. For some reason, you don't have those crowds showing up at your things saying, "I need your service right away."
Not anymore.
Which brings me to the point we were talking about. It was kind of interesting. I don't even remember how we got into it, but you made a point that we all have disaster plans in surgery centers. We, Sue and I preach it on the podcast. We preach it with our clients that, get in your disaster plan. What happens if your generator goes down? What happens if your water goes down? What happens if, a computer system goes down? But you said something earlier today, like what happens when your coder quits? And I guess you couldn't really call that a disaster, but in terms of an emergency, it certainly is something important. So I thought that would be a great topic to talk about, preparing yourself for it and also what the ramifications of even losing a day's worth of coding could be. So first of all, welcome to the podcast. It's great to have you on board. So tell us a little bit about your thoughts about, how you plan for that and, how companies such as yours obviously can fit in, even if it's temporary. I mean, you can either decide this is it. I want to have a service permanently or, I just need something on a temporary basis.
Well, thanks for having me, John. One of the things in dealing with clients, all of them have these 3-inch binders that show what to do in the event of an emergency, a natural disaster, whatever. But I've talked to people quite frequently, and usually on Monday morning at 8 o'clock, that say, my coder had a car accident this weekend. My coder was painting her house and fell off a ladder and can't work for the indefinite future. What can I do?
Right. And how quickly can you do it?
Yes, and how quickly can you help me?
Yeah.
And, companies like ours, we're set up to where we can handle short-term
Right.
emergency problems like that. But, typically there's still a lot of paperwork. You've got to get a business associates agreement in place. You've got to get some kind of at least a letter of agreement or if not a more formal contract in place. So it's good that people recognize something's like that and are willing to take the preemptive measure of having that type of relationship established before they need it.
Right. And I think that's the important thing. Whether you hire a company like yours or, I guess I could say, if you're part of a practice, for example, you might, as part of your plan, say, okay, this is my coder now, but if they were to go out, we'll bring somebody over in the practice. I don't particularly care what your plan is. What's important is that you have a plan. And to be honest, in your in the business of coding, it is so difficult right now to get coders, let alone get somebody that's experienced in ASCs.
Right. And one of the things that I run into, and I talk to coders frequently that say, I haven't had a vacation in 6 months, or I haven't had a vacation in 2 years. And the first thing is like, well, why not? And they go, well, I don't want to have to get caught up on everything that happens while I'm gone.
Right, right.
And, establishing a relationship with somebody like MD Strategies can help you bridge a short-term gap. Or in the event of a more dire situation, like I had a group last year that called me. The lady said her coder was painting her house and fell off a ladder and broke both of her arms, which, is obviously a very tragic situation. And
probably not able to code during that period of time.
Yeah, couldn't use a computer during that period of time. And I forget, it was about 6 weeks, if I remember correctly. But, obviously most ASCs cannot go 6 weeks without being able to submit some bills.
Well, and let's talk about that for a second, because that's something that I'm passionate about. We've doing a couple of sessions. I think I mentioned in New Jersey, I did a session recently about, what do you do when you get into an AR problem? And one of the things that I talked about is what every extra day in receivable is worth to you. It's basically take your total net revenue, divide it by the number of, days, and that is your daily revenue. And every day that you're not coding, every day that you're not billing, means that you're losing that. Now, not permanently, but you're not getting that cash in. So, think about it. If you're billing out net, $25,000 a day, 1 week, 5 days, and actually you have to add the weekend there because obviously nobody's coding on the weekend, is going to equate to, in this case, $125,000 that's being held up for, 7 days there that you don't get that cash until, 1 week later than what you expected.
Right. And frequently it can be longer because when the coder comes back, they've got to get caught up. So it frequently can double that length of time. And if you're borrowing money on a line of credit, you're actually paying to pay interest on to keep the bills paid. I have found that a lot of employees don't like to work when they don't get paid. Yeah. So if the cash flow,
it's a sad thing for those of us business owners. I don't understand it.
The workflow there can get impeded when the employees get upset about not getting paid. So you want to try to minimize those situations when all possible.
So I think there's two sides of it. There's that emergency side we just talked about. But let's talk about just the daily. You mentioned, people being on vacation. That alone, we've heard this attitude. You've heard this attitude. Well, I'll just wait till they get back. And just talk a little bit about what's wrong with that analysis.
Well, and again, it just kind of amplifies what we were talking about. If an employee takes a week, which most employees get at least a week, if not two. Right. But, if they want to go on a cruise or they want to go somewhere that's a little bit extended and you don't file any claims while that person's gone because you don't have that resource, you're back to borrowing money possibly on a line of credit.
Or going back, the worst thing in the world, going back to the doctors and say, you're not getting the distribution this week, or even worse, I need to borrow some money from you to get through.
Cash call. So
that's usually not a very good thing for your career.
Yeah, they don't typically like that. So having a relationship like that is where you have a resource in just, if it's overflow work, we're heading into the fourth quarter of the year, and that typically, during the time I've been doing this, it will increase anywhere from 10 to 15% over what you're doing on a prior quarter during the fourth quarter. And as we get closer to the holidays, it ramps up even more. So
at a time when people are taking more vacation or are out, absolutely.
And again, that's people want to be off during some of those times, and it's bad for employee morale when you tell people
no vacation before Christmas.
Yes, no vacations in December or whatever, which I frequently have to do as well, just because.
Well, you got to keep your employees happy still.
Yeah, you want to try to. It's hard to keep everybody happy. Hard to keep all the employees happy and all the clients happy at the same time. So it's a juggling act for the managers in that situation.
Talk a little bit about right now where we are with coding. Getting coders, hiring coders, because I think that's a challenge. Many organizations that are going to hire companies to, basically outsource. And we actually, a previous episode here, we're talking about outsourcing and how outsourcing is becoming very popular now, because the nice thing about outsourcing is you do hopefully do away with that situation in which somebody leaves you suddenly and you're suddenly stuck. Like if you're outsourcing regulatory compliance like us, you don't have to worry about that nurse leaving. We're covering you during that whole period of time. Same thing with coding. But often right now, I think we're running into a situation where it's hard to hire people. Is that what's happening in coding too? Where we are with coding and having people? I know a lot of it's regional. Like you might live in East Podunk. Hopefully there is no such place as Podunk. Otherwise, I'm in big trouble with our listener. But you might be in a very remote area and you don't have a coder. So talk about two things. First of all, yours my passion about making sure that you hire coders that are certified, as well as just getting coders in general right now. Where are we in the industry?
It's a tight market, definitely. I think we're still facing a little bit of restrictions with people getting extended unemployment benefits and things like that. Lower level coders or newer, less experienced coders don't make a whole lot more than some
unemployment,
than unemployment can make in some cases. And, also some of the other things of coders going into an office and they don't feel comfortable in this environment now. Some of them have retired, which is pulling some of the other coders up a level, which is not always a bad thing. But, in our particular case, one of the most difficult things we find is getting experienced coders in multi-specialty. You can find a good orthopedic coder that knows nothing about urology and GI,
right?
Or you can find a good GI coder, but they don't know anything about ENT or urology or something like that. So
my best example is I can code eye cases. I've been doing eye cases for 17 years. I used to teach coding, but show me orthopedics, there's no way. I don't even understand half the words, in that
and it's getting even more so now with, as I'm sure you know, one of the big trends in ASCs is cardiovascular.
Yeah.
And
we know nothing about it.
Nobody does.
Yeah, right, right.
It's a little bit of a blind, leading the blind kind of thing with some of this stuff in an ASC setting because it just hasn't been done before. So
let's talk about the issue of the experience level of coders and getting certified. You and I were talking earlier, so one of the arguments when somebody leaves the ASC, the coder leaves the ASC, the owners will say, well, I'll tell you what, I'll just lend you my coder from the office. You can use her for a while. What do you think about that answer? And of course, what they're going to say is, because our codes are better anyway, we might as well just use the code that the office is using, right? What could go wrong?
It's... And in some cases, that's perfectly fine. Most cases, it tends to have some issues.
Yeah. And talk about that, because coding for an ASC is different than in the office. It's not wholly different, but it does take different sets, which is why you have different certifications.
Right. The facility fee coding is a little bit different. It should be very close as far as, the primary procedure codes and the primary diagnosis code should be the same. But there are a few exceptions where the doctor's office can bill for things that the facility cannot.
Right. Modifiers are too a big
Some
thing.
of the modifiers are different and so forth. Yeah. And, we see a lot of things where people are just not, and particularly when they come in from an office, they're maybe not having the most recent material. Recently had a case, one of our clients is in the process of buying a facility, and we did a due diligence audit. And I don't know if they were facility coders or I don't know who did the coding, but they were using some codes from 2018.
Yeah.
Or I should say they were using something that was superseded in 2018 and some procedures that are now bundled that they were still unbundling.
Yeah.
And led to probably a slight inflation of their revenues at this particular facility. So I don't know how that's going to wash out for my client. But there are things like that keeping up to date, and we spend as I write the checks for all the books and the different materials that we purchase, it's quite expensive to stay up to speed on everything. Right. And that's one of the things that partnering with a company is. Even if one of the things that we will do is kind of a hotline service, where if you don't use us in a full capacity for all your coding, if you just want to get a second opinion on something, to send it in. And
that's great.
It helps.
It's a retainer type service or fee for?
Typically it's fee per event.
Okay. And I didn't know that. That's good.
Yeah, it's, and we will price it accordingly depending on, but it's, pretty inexpensive when you look at the fact of, am I capturing all the revenue I should be capturing on this thing?
Especially if you're running into something that you hadn't coded before or a new experience, because that's going to happen. I think we're finding a lot with total joints right now. I don't code anymore. I could never teach like I did before coding. I mean, I'm so far behind that. But I can't imagine that coding for totals is easy.
Again, I'm not a coder.
I know.
I can't.
I'll put you on the spot there.
I can't speak to, and from what I understand, if, so many times with, be it total joints or whatever, if the documentation is right, my understanding from my managers is that total joints are less complicated than some other procedures if the documentation is correct. Right. And that's one issue you run into frequently is that there are varying standards of documentation. So sometimes you get all the information in a nice, concise little report, and other times you get the documentation and you're not sure what the doctor did.
A lot of our audience are administrators and nurse managers here. Talk a little bit about the importance of, we're here at the Ohio State Association conference here. Talk about the importance of getting the coders out of the office or virtually. I mean, it doesn't really matter how you do it, but getting some annual training for them. How important do you think that is?
Well, in this day and age, it's very important. We're about to, I have not seen personally, but here at the end of this week, we're going to have a whole new set of ICD-10 codes that kick in.
That'd be fun.
And then, of course, in January, we'll have a whole new set of not a whole new set, but a number of additions to the current set of CPT codes and modifiers. And one of the things right now that is crazy are additional HCPCS codes. Because they're getting new products approved. They're getting new implants for different things approved, and keeping up to speed on what products have a payable code now versus what's still experimental or what's still considered experimental and has to be reported unlisted is a very important thing.
Yeah.
And of course, you don't want to go the other way where you report the payable code first before it gets approved, when you should still be using the unlisted. So
do you have a feel for what's going on right now with auditing, activity, from the government of looking at claims right now?
No, I wish I could.
Yeah.
I haven't really seen. I know we have clients in varying parts of the country, and some of them commercial carriers are a little more aggressive.
Right, even
auditing.
in Medicare. Yeah.
I have not seen really a lot of aggressive Medicare auditing in an ASC setting. Have
you seen it in the past? Like, how would you equate it? I know you probably know a little bit about the frequency. Is it because there just isn't a lot of activity right now? Do you feel like that might have been in the past, or?
I think personal feeling strictly, of course, 4 or 5 years ago, everyone was all up in arms about RAC audits.
Right.
And we still get a question here and there that a RAC audit was done.
Yeah.
My personal opinion is that, particularly in Medicare, there's so much more opportunity to get recoupment in a hospital setting as opposed to the revenues in your typical ASC.
Right. That's a good point, because we've been seeing that happening nationally.
Medicare being, from what I understand, understaffed,
right,
particularly as it relates to auditors. there's more opportunity for recoupment going after a big hospital that may have billions of dollars in revenue versus an ASC that may have, not even 10 million a year in revenue or something like that.
Well, especially since they extrapolate that data. So, extrapolating something that happened in a surgery center over the number of cases there compared to what you would have in a hospital would be, a lot more money from the hospital. Very good point.
Right.
Lastly, just talk a little bit about, hiring somebody to come in on a periodic basis to look at your coding. I know that's a service you offer. How important do you think that is, regularly doing some coding audits?
I think it's very important. I like to tell people if they're unsure about it, it's kind of like that annual physical you get.
Yeah.
You may not want to do it, and it may not always, parts of it may not be pleasant when you have to actually go in to get your physical. But if you get a clean bill of health, it's kind of self-assuring and reassuring to know that, everything is good and I can proceed on. We have clients that do quarterly audits. We have clients that do biannual audits. So they have, if they feel every 2 years is sufficient and they don't have a change in coding, then, that probably is sufficient, assuming everything was good previously. I've always told people that, if you get a new coder in, even you think I wouldn't let them go more than 90 days just
double check
because it's too important to the cash flow of the facility to go down the wrong trail.
Right.
You don't want to have to come back, a month later or 6 months later and have to refile 20% of your claims because you found out your coder was missing something.
Right. And I'll add to our listeners also, keep in mind that your corporate compliance plan might actually state that you have to have periodic coding audits done. I find that, periodically people have, implement this corporate compliance plan, never read it. And it says something like on an annual basis or on a quarterly basis, I'm going to do coding audits. So certainly, now there is no requirement that you do this. There's a requirement that you have a corporate compliance plan. There's no requirement that you specify a time frame, but many of those cookie cutter compliance plans out there actually tell you that they have to do it, and people fail to do that. So good thing to check into.
Yeah, I've seen, and it can vary depending on if you're part of a group that has 250 facilities or if you're a group that has, 10 facilities, it could be, or an independent facility, depending on how you're structured. Typically, I find that a lot of the smaller facilities, the independents, are the ones that don't necessarily get an audit done frequently, and I think they're the ones that probably need to have one done more. A big company typically has a corporate policy in place, and there's a regional manager or someone that's in charge of making sure that you've had an audit done, within the last year or the last 6 months, whatever the case may be.
Scott Magnuson with MD Strategies. As always, it's a pleasure talking. First time that you've been on the podcast, I should point that out. But you and I talk a lot, and I'm sure we'll see each other at some conferences. This has been a pleasure. Thanks so much for joining us.
Thank you for having me, John. I've really enjoyed it.
Thank you.
And our next interview was with Tori Kalet. She's with AmSurge, and this time she was talking about her speech, which was "Doing This Will Make Your Center a Top Performer." So that was quite interesting.
It was.
I love the name.
It was a great title, and we had her in the office. We had a little mini studio there, so we had her there, and we tied her down because she doesn't. It's funny because she doesn't feel like she wants to talk, and that she does a fantastic job. So we tied her down and told her that after we interview you as the immediate past president, we just wanted you to talk about one of the speeches. And I think next year when we're able to get back again and get things back on more of a normal schedule, we'll have more interviews of people that did speeches, but these were the only two we were able to do. So let's listen to this great interview with Tori Kalet regarding "Doing This Will Make Your Center a Top Performer."
So this is John Goehle. I'm here with Sue Cronkite, and we're interviewing Tori Kalet. Tori, you've been a friend of ours for a long time, and I guess I have to kind of mention here that your old center, the center that you came from before you went to your current employment, was our first client at Ambulatory Healthcare Strategies, and is still, is now our oldest client. So thank you for that opportunity. Thank you for the trust you had in our company and all of the great years we had together. And now, Tori, tell us about where you are.
I work for a national company. I work for AmSurge. I am a senior clinical director. I really enjoy what I'm doing. and working with, at the current time, 16 different centers and different center administrators. I think the part that I like the best about it is my position is all clinical now.
Yeah.
So being a nurse, the business side of being an administrator was a little bit more foreign to me.
Yeah.
I feel like I learned a lot, and you really taught me a lot
Thank you.
the 5 or 6 years that you guys were with me as the administrator, especially when I covered all the different roles in the office for a couple of years there while we were looking for other people and everything. But yeah, I really enjoy what I'm doing now. And
Well, I think that's one thing for nurses, I mean, you can get through the administrative stuff, but your first love is always taking care of the patients, taking care of other nurses. And you always did a great job of that. And
thank you.
I'm sure they're enjoying that interaction. Plus the fact that, just like I had 17 years as an administrator, you had a lot of years in the trenches. So when you're working with all those centers, they can't come back and say, well, you don't understand what it's really like here.
And, that's been one thing that I've really, I worked there for 12 years, and I started the place, and I really thought I would just retire there. But it was really scary starting out again. But I'm really happy I did it, because I feel like when I do work with my administrators, you're right. I can say, no, I already did that.
That's right.
And that doesn't work.
That's right.
Or I understand where you're coming from. HR was always a sticking point and always hard. You're a nurse, you're not a human resources. And there's a lot of rules and laws that you don't even know as a nurse. So having HR help was amazing.
Yeah. So you're here at the Ohio State Association conference, and did you anger somebody that you're the last person on the agenda? or maybe it's because they knew your speech was going to be the best and it'll keep people until the end.
No, I'm perfectly happy with being the last. I was at a different time slot, and they asked me to move back because somebody had a flight to catch that was speaking, and I was like, perfect, because the more people that are gone, the better I'll feel anyhow standing up there in front of everybody.
You're going to do a great job.
And the funny thing about my presentation, which is called Doing This Will Make Your Center a Top Performer, is the biggest thing that I've noticed is everything that I say in here, somebody's already said it.
Yeah.
At least twice or more.
Yeah.
I mean, so everything that I feel like I'm going to go over has already been gone over. So I think that kind of reinforces in my mind exactly what I'm trying to explain to you. This is not a catch-all. It does not talk about every single thing you need to do to make your center wonderful. But it does talk about the top things, because everybody else has been talking about these for 2 days now.
That's right.
Yeah, both together.
I think that's, I did a speech just a couple hours ago, and one of the things that we always want to do is, when you talk for an hour, you're going to talk about a lot of different things, but you got to leave them with some real bullet points that they take away from it. And hopefully that'll be what triggers them. And so the first line in your description says, adding a few important details to everyday life can help your center be a top performer. So tell us what those, we'll go right to the point.
Okay, let's go right to the point here. All right. So some of my top things are quality.
Yeah.
Quality.
There's your 3 bullets.
there's 3 of the 5. No, I think the hardest thing that the administrators I work with ask me about are quality studies. And I am not really sure why everybody's so afraid of them or thinks they're so hard. They really, once you start to work on them and look at it, they're really simple.
Yeah.
And they can make a big difference in your everyday life at your center. I mean, you can really find some things that can be improved and make it better for your center. You can stuff financially, stuff just patient safety, and they're just real important. I mean, I guess I don't know how else to say, but I feel like quality studies are the hardest thing for everybody, and yet they should be the simplest thing for you. That's easier than credentialing, in my opinion. You really have a lot to worry about when you credential. Are you, finding the correct information?
Is there any quality improvement study that stands out recently from one of your centers? You got to have one good story out of 16.
I think the biggest one that I've been pushing my centers to do is it seems to me like AAAHC is really asking a lot for the MIFUs on everything.
Yeah,
and they're
point.
wanting to see the MIFU and that you're doing what the MIFU says.
Manufacturer's instructions for use,
Yes,
by the way.
thank you.
That's what we all do in this business.
Yeah. We live by initials and everything.
Yeah.
But so that is a study that I have 3 of my centers doing.
Mm-hmm.
Do you have all the MIFUs for all of your patient care equipment?
Yeah.
And are you following them?
Yeah.
Because a lot of them are like, yeah, we have all this stuff. I'm like, yeah, but do you have it from 1970 or do you have the one that just came out in 2020 that says you don't clean it with this anymore? You have to use this solution or whatever. So
And are all of your pages stuck together because it hasn't been opened in 8 years?
yeah, right. Yeah. So that is one of the studies that I have people doing. And then one of my centers, she took the job as center administrator basically 2 weeks before AAA walked in for her, and she worked in a hospital before, so AAA was really new to her, and they got cited for a bunch of on their quality studies because there wasn't really any done, and she didn't have the time to do them because she just walked in there 2 weeks before. And the biggest thing that she did as soon as she took that job was she started going through the cupboards and looking at things. There was stuff in there that was expired from like 10 years. So she got it upon herself to do a study on expiration dates and making sure that everything was out of there. So I literally just helped her write that up a couple of weeks ago when I was out visiting her. And I think it's a great study after we did that because even after we wrote up the initial, she's now looking at it for the next 3 months because they have inventory in the middle to see how well her staff does at picking out stuff that's expired again. She's going to look at it after the inventory because, that her restudy was in the next 3 months. So.
So think of what you just did. You just helped 300 centers in this country right now to come up with a quality improvement study, which I don't think anybody's talked about. That's a great idea.
Yeah, I think it's a great quality study. I'm not, trying to toot my own horn here, but that was just one thing that I thought of. And I never even thought of that when I was an administrator. Right. But just going forward, when I start visiting my centers and I see that they don't have this stuff, it kind of hits me as like, oh, here's a quick study for you.
Well, it's so funny because, of course, Sue is working with your former center right now to get quality improvement studies. So I noticed that she was frantically writing notes as we were preparing for this. So I think we got the problem solved. So what else are you going to talk about as some top things?
Some of the other top things. I wanted to talk a little bit about staff evaluations because the state of Ohio says they have to be done annually, where AAAHC says periodic. Right. So you have to really be careful in your state as to what does your state actually say. So,
and brings up a very important point that we always have to emphasize is that we spend so much time concentrating on the federal conditions for coverage and the interpretive guidelines that sometimes I find a lot of places don't even look at their state regs. Very good point. Right.
And see, I'm fighting with a center right now that wants to drop the H&P. Because it's a nice eye center, and they don't feel like they need to do their H&Ps, but they're AAAHC certified, and their state says they have to do a H&P. So I'm not really fighting with the center. I'm just sending the information to the center leader so that she has the paperwork in her hand to back up when this medical director keeps saying, I don't want to do these. Well, right here says you have to. Right. So and
a little bit of point of reference too, because as we all know, but again, I may explain it to our audience, is that it was the Ophthalmology Society that went to CMS to argue to have the requirement from a CMS, from a certification standpoint, removed, but it's virtually irrelevant in almost all states and anybody that's accredited because most of the accrediting organizations at least require an H&P. Maybe not the time frame that CMS had, but very good point that most of us really can't take that away. Not to mention, I don't think we want to. I mean, I get it for some of those local cases, but these major cases, no.
Yeah, no, there's too many people trying to do surgeries really on patients that do need to go to the hospital. I mean, I'm every day, bring them to the ASC, bring them to the ASC. But there are the patients that need to go to the hospital, that they're out there and, it should be done safely.
Right, absolutely.
So another thing that I really wanted to talk about in my talk here was about the Respiratory Protection Program because ASCs haven't had to do this. When I first started my center in 2008, we bought one box full of N95s, thinking, okay, we're going to have this. And they sat back on the shelf They got completely covered in dust.
Yeah.
And then I read somewhere a few years later that if we're going to have these, we have to have a respiratory protection program in place. And I'm like, oh, yeah, we're not doing this. Throw these masks away. So, in
1 week before the pandemic, probably.
Probably in 2010, we probably threw those things away 2 years later. But now, because of the pandemic, I do have a whole slide on a respiratory protection program and handouts on how to at least set this up, just to help people with it. Because most people probably have it set up, but there are a few little things that you have to have in order to do that.
And for those of you that are listening, and I'll probably try to remember to put a link in here. The good news is this information is available right on the OSHA website. There's even sample plans, which I'm sure was probably the basis for it. But that's a really good point that we really need to make sure. I can't believe, Tori, how many times I walk into a center now and, N95 is being used. Of course, N95 is being used over and over again, which of course is wrong. And no respiratory protection. So thanks for bringing that up. Yeah.
And then if you have a center that doesn't need the N95 particularly, you can still adapt that program to fit a KN95. You just fit it to what you do in your center. You need that KN95 on your crash cart in case you have to do CPR. Yeah. Or if you're doing an ocular plastics case, where you need more protection, then you may have to have that N95, in your center. But if you don't do anything like that, adapt your respiratory protection program to the KN95.
Very good point. And of course, the KN95 is not a respirator, but you're right. Your point, and that's one thing that we have been saying lately is people are saying, no, I want my N95. We actually, we're sitting here, we're actually maskless, which is a lot easier to talk. But we have KN95s, sitting around the table here, because I think people do feel they do fit differently. They do feel well. But if you've been wearing an N95 and convert to this, you don't need the respiratory protection program or, more importantly, the fit testing. But you're right. If you have the respiratory protection program, at least you can differentiate in the program as to the attributes of them too. Yeah. Yep.
And then vaccine management, since we've gone into the COVID era here, the AAHC book now is talking more about the manual, I guess it is talking more about vaccine management. And, monitoring your refrigerators is a lot different than it was even a year ago or 2 years ago. I think the book came out in 2020.
Yeah, V41.
Yeah. So, you have to monitor that 24/7 now. Yeah. And does everybody have that? Like Alethea was talking about, somebody put ice in a cup and put a penny on top for the weekend. Yeah. And if their refrigerator went out, that's how they monitored.
It was down at the bottom.
The penny melted, the ice melted, the penny fell to the bottom, you know. You need the 24/7 monitoring of your vaccines. And do you want to do that? If you don't want to do that, write your policy that you're not going to keep vaccines, that your vaccine management program is to get your employees vaccinated through occupational health.
Right.
I mean, you don't have to do it in-house. Your program can put you elsewhere to take care of it, as long as you're providing something.
And I think we do need to point out, too, that we are starting to frown upon non-medical grade refrigerators, like we call them dorm room refrigerators. Yes. That's fine for food, not fine for medications in general, and certainly vaccines, because they're just too unstable in terms of their temperature. So great. Well, Tori, as always, it's great talking to you. It's great to be in person again, and I'm so glad that your career is really taken off there. I'm very proud of you. You've worked hard to get to where you are, and I was just telling Tori that I'm going to recommend her to be a surveyor with AAHC very soon. So as that things opens up, I think you'll be a fantastic surveyor.
Thank you. I'd love to do that.
As always, it's a pleasure having you on the podcast.
Thank you, John.
We would like to thank our sponsors, Surgical Information Systems, providing cutting-edge information solutions for surgery providers, and Ambulatory Healthcare Strategies, the nation's leading regulatory compliance resource for ambulatory surgery centers. For more information about our sponsors, visit our website at ascpodcast.com. This podcast has been an educational and operational tool and is not intended to be a comprehensive resource for all rules, regulations, and standards that an ambulatory surgery center must meet. The advice provided should not be considered as, nor does it constitute legal advice or opinion. When reviewing specific situations involving legal and regulatory issues, attorneys and other professionals should be consulted. This has been a production of Eden Group Development. All rights are reserved. If you're interested in advertising or sponsoring the ASC Podcast with John Goehle, please email us at info@ascpodcast.com. We would love to hear your questions and comments. Please email us at comments@ascpodcast.com.